April 23, 1945. 2:47 a.m., 15 miles southeast of Munich, Germany. SS Obersturmführer Franz Dietrich pressed his hand against the torn flesh of his abdomen, feeling warm blood pulse between his fingers. The concrete floor of the farmhouse basement where American soldiers had dragged him was cold, colder than he'd imagined death would be. Above him, boots thundered, voices shouted in English. He'd spent 3 years teaching his men that Americans were soft, that Jews were subhuman. Now he would learn what animals do to their captors. The pain was extraordinary. Shrapnel from the M1 Garand round had torn through his intestines, and he could smell it. The distinct odor of perforated bowel that every combat soldier recognizes as the scent of dying. He was 29 years old. He'd executed 17 American POWs near Malmedy. He expected no mercy. Before we continue with Captain Goldstein's incredible story, we need your help to keep these forgotten heroes alive. If you're already hooked by what you're hearing, hit that like button right now. It tells YouTube to share this with more people who care about real history. Subscribe to this channel so you never miss another story of courage and innovation from World War II. And here's something we love. Drop a comment below and tell us where you're watching from. Your country, your city. We have viewers from Buenos Aires to Berlin, from Manila to Montreal. Are you a veteran? Did your grandfather serve? Do you have a connection to this war? We want to hear from you. Now back to that farmhouse basement outside Munich, where Franz Dietrich was about to encounter something he never expected. Captain Samuel Goldstein had never wanted to be a soldier. Born in 1916 in Brooklyn, New York, Sam grew up in a cramped apartment above his father's tailor shop on Delancey Street. He was short, 5 feet 6 inches, with thick glasses that made him look more like a librarian than a warrior. His hands were steady, his voice was quiet, and by the time he was 14, he knew he wanted to heal people. His mother had died of pneumonia when he was 12. He'd watched her suffocate slowly, watched doctors shake their heads, watched his father weep. Medicine in 1928 couldn't save her. He'd sworn he would learn what they couldn't. At Columbia University, he finished pre-med in 3 years. At Columbia College of Physicians and Surgeons, he ranked second in his class. He was 25 years old, 6 months into his surgical residency at Mount Sinai Hospital, when Germany invaded Poland. His father's cousin sent letters from Warsaw, increasingly desperate, then nothing. By 1941, Sam knew what was happening in Europe. When Pearl Harbor was attacked, he enlisted the next morning. The army didn't want him in combat. They needed surgeons. In 1942, he was commissioned as a captain and assigned to the 15th Evacuation Hospital, a mobile surgical unit that followed 3 miles behind the front lines. His job was simple: keep soldiers alive long enough to evacuate them to rear hospitals. The survival rate for abdominal wounds was 39%. For perforated intestines with sepsis, it was 11%. Sam had lost count of how many boys he'd watched die. Between D-Day and April 1945, the 15th Evacuation Hospital treated 347 wounded soldiers. 923 died on the operating tables. Sam performed an average of 14 surgeries per day during heavy fighting. He slept in 3-hour intervals. He ate cold rations while reviewing X-rays. His hands never stopped shaking anymore, but they remained steady when he held a scalpel. The first friend he lost was Lieutenant Marcus Chen, a surgical assistant from San Francisco. Marcus and Sam had talked about opening a practice together after the war, Goldstein and Chen Family Medicine, right in Brooklyn, 50-50 split. Marcus wanted to specialize in pediatrics. He'd shown Sam photographs of his nieces in California. They'd shaken hands on it the night before the bulge, December 18, 1944. A German artillery shell landed 30 feet from their surgical tent. Marcus was outside smoking a cigarette during a rare break. The explosion threw him 15 feet into a supply truck. Sam found him unconscious, skull fractured, both legs shattered. He operated for 4 hours. Marcus died on the table at 3:22 a.m. His last words, whispered through blood-filled lungs, were, "Tell my sister I tried." Sam wrote the letter himself. He still carried Marcus's photograph. By April 1945, the problem wasn't German resistance, the problem wasn't Allied logistics, the problem was what to do with wounded enemy soldiers. The Geneva Convention was clear. Medical personnel must treat all wounded combatants regardless of nationality. But the 15th Evacuation Hospital was overwhelmed. They were processing 200-300 casualties daily as American forces pushed into Bavaria. Every operating table was occupied. Every surgeon worked until exhaustion. Supply lines stretched thin. Plasma ran low. Morphine was rationed. And then there were the SS prisoners. The 3rd Infantry Division had begun capturing Waffen-SS officers as they broke through German defensive lines. These weren't conscripted Wehrmacht soldiers, teenage boys forced into grey uniforms. These were SS Obersturmführers and SS Hauptsturmführers, officers who'd overseen concentration camps, executed civilians, murdered POWs. They arrived at the 15th, with bullet wounds, burns, shrapnel injuries. They wore the death's head insignia. They expected execution. Standard protocol was to stabilize them, document their unit affiliations, and transfer them to rear area POW facilities for interrogation. But stabilization required resources, the same resources needed for wounded Americans. Every pint of plasma given to an SS officer was a pint unavailable for a 19-year-old rifleman from Iowa. The moral calculus was impossible. Sam had seen what the SS did. On April 11th, when Buchenwald was liberated, medical officers from the 15th were sent to assess survivor conditions. Sam volunteered. He spent 6 hours documenting medical conditions of 21,000 starving prisoners. He saw the crematoriums. He saw the surgical experimentation rooms. He saw stacks of bodies, thousands of bodies piled like cordwood. Many were children. He recognized the yellow stars sewn onto striped uniforms. His father's cousin had worn that star. When Sam returned to his unit, he didn't sleep for 3 days. He operated mechanically, spoke minimally, avoided eye contact. Major Richardson, the chief surgeon, pulled him aside. "You need to talk to someone, Sam." Sam shook his head. "I need to work." But something had changed. When the first SS prisoner arrived, a 23-year-old with a sucking chest wound, Sam looked at the death's head insignia and felt nothing but hatred. He stabilized him. He did his job. But his hands shook more than usual. He imagined his father's cousin on that table. He imagined all the people this boy had killed. The SS officer lived. Sam transferred him out within 8 hours. He told himself it was enough. April 23, 1945. 3:15 a.m. Franz Dietrich was carried into the 15th Evacuation Hospital on a stretcher, unconscious, blood pressure dropping. 2 MPs accompanied him, both wearing grim expressions. A sergeant handed Sam the intake form. SS Obersturmführer, captured near Grafing, 3rd SS Panzer Division, shot during firefight with our forward scouts. We found documents linking him to massacres near Malmedy. Sam looked at the patient. Dietrich was pale, sweating despite the cold night air. His SS uniform had been cut away, revealing the abdominal wound, a ragged hole 3 inches below the ribs, right side. Dark blood pooled around him. His breathing was rapid and shallow. Sam's first instinct was to turn away. Let him die. Let nature do what justice demands. But then he touched Dietrich's abdomen and felt the rigid, board-like tension of advanced peritonitis. The bullet had perforated the intestine. Fecal matter was leaking into the abdominal cavity. Sepsis was setting in. Without surgery, Dietrich would die within 6 hours, a slow, agonizing death as infection consumed him from within. Marcus's voice echoed in his memory. "Tell my sister I tried." Sam looked at the sergeant. "How many American wounded are waiting?" 12, sir. 3 critical. All accounted for and in surgery now." Sam examined Dietrich's pupils, reactive but sluggish. Pulse was 134, thready and weak. Temperature 104, 3° Phi. Classic signs of septic shock. The clock was ticking. Every other surgeon would have given Dietrich morphine and moved on. Stabilization only. Let him survive long enough for interrogation, then let the infection take him. Sam did the opposite. "Prep him for emergency laparotomy," he said quietly. "We're operating now." The surgical nurse, Lieutenant Alice Morrison, Marcus's cousin, stared at him. "Sir, he's SS. There are Americans who need—" "I know what he is," Hitam interrupted. His voice was steady. "Prep him. Sam scrubbed for 8 minutes, methodical and thorough, while 2 nurses prepared the operating theatre. Outside, artillery rumbled in the distance, the war continuing its relentless advance. Inside, under bright surgical lamps, Sam pulled on sterile gloves and approached the table. Franz Dietrich was awake now, barely. His eyes, pale blue, bloodshot, tracked Sam's movement. He saw the Star of David on Sam's dog tags. Understanding flickered across his face. "You're Jewish," Dietrich whispered in English, his accent thick. Sam didn't respond. He nodded to the anesthesiologist. "Put him under." The ether mask descended. Dietrich's eyes widened, not with fear of death, but with confusion. Why would a Jew save him? Why wouldn't they simply let him suffer? Sam made the first incision at 3:47 a.m. The damage was catastrophic. The bullet had entered just below the rib cage, fragmented, and torn through the ascending colon and small intestine in 3 places. Fecal contamination had spread throughout the peritoneal cavity. The intestinal walls were inflamed and necrotic. Sam worked quickly, resecting the damaged sections of bowel, carefully debriding contaminated tissue, irrigating the abdomen with liters of saline. Lieutenant Morrison assisted, her face expressionless behind the surgical mask. She'd lost her cousin, Marcus. She knew what Dietrich represented, but she handed Sam instruments with practiced efficiency, anticipating his needs. Clamp. Suture. Irrigation. The surgery lasted 6 hours. At 4:30 a.m., Sam discovered the worst complication, a perforation in the duodenum, leaking bile. He spent 90 minutes carefully repairing it, his fingers cramping, his vision blurring from exhaustion. He could smell the distinct odor of bile and feces mixing with blood. His surgical gown was soaked with sweat and other fluids. At 6:00 a.m. he faced the critical decision. Dietrich's infection was severe. Peritonitis with sepsis had a mortality rate exceeding 80%, even after successful surgery. Standard protocol was to close, administer sulfur drugs and hope the patient's immune system could fight off the infection. Most didn't survive. But Sam had something else. Penicillin. The miracle drug had arrived at the 15th evacuation hospital 2 weeks earlier. 12 vials, enough for exactly 12 patients. It was so scarce that it was reserved exclusively for American soldiers with life-threatening infections. Each vial represented countless hours of laboratory work, complex manufacturing processes, precious resources diverted from civilian use. Each dose could save a life. Sam stared at the locked cabinet where the penicillin was stored. Using it on Dietrich meant one less vial for an American soldier. It meant choosing to save an SS officer who had murdered Allied prisoners, who had participated in genocide, who represented everything Sam had sworn to fight against. Lieutenant Morrison saw where he was looking. "Sir, you can't be serious." Sam's hands were shaking again. He thought about Buchenwald. He thought about his father's cousin. He thought about the 17 American POWs Dietrich had executed. Then he thought about Marcus Chen dying on this same table, whispering, "Tell my sister I tried." "Open the cabinet," Sam said quietly. "We're using penicillin." Morrison didn't move. "Captain Goldstein—" "That's an order, Lieutenant." Morrison unlocked the cabinet with trembling hands. She handed Sam the vial, small glass containing a yellowish powder that would be reconstituted with saline. 1 million units of crystalline penicillin G, enough to potentially save Dietrich's life. Sam prepared the injection himself, his hands steady now despite the exhaustion. He administered the dose directly into Dietrich's abdominal cavity before closing, then set up an IV drip for continuous dosing over the next 48 hours. At 9:53 a.m., he finished the final suture and stepped back from the table. Dietrich was still alive, vital signs stable, infection contained. Sam pulled off his bloody gloves and walked outside into the cold German morning. He lit a cigarette, something he rarely did, and stared at the horizon where smoke rose from burning villages. His hands were shaking violently now. He thought he might vomit. Major Richardson found him 20 minutes later. "Sam, what the hell did you do?" Sam took a long drag. "My job." "You used penicillin on an SS officer." Do you understand what that means? We have American boys who might need— We have 11 vials left, Sam interrupted. We have 12 Americans in recovery who will need them more. I made the calculation. Richardson stared at him. This isn't about calculations, Sam. This is about being better than them, Sam said, his voice hard. This is about not becoming what we're fighting against. I'm a doctor before I'm a soldier. I took an oath. So did you. Richardson had no response. He walked away, shaking his head. Sam finished his cigarette and went back inside. He had 14 more surgeries scheduled before nightfall. Franz Dietrich woke 31 hours after surgery. His first sensation was absence of pain, not complete absence, but a dramatic reduction from the agony he'd expected. He opened his eyes and saw white canvas above him, the interior of a hospital tent. An IV drip ran into his arm. Bandages covered his abdomen. He was alive. A Jewish doctor had saved him. Sam was doing rounds when Dietrich woke. He approached the bed with a clinical detachment, checking vital signs, examining the surgical incision. Temperature down to 100. 1 degree AMIV. No signs of renewed infection. The penicillin was working. Dietrich watched him in silence for several minutes. Then, in careful English, "Why?" Sam didn't look up from his chart. "Because you're a human being. I'm SS. You know what that means." "I know exactly what that means." "Then why save me?" Dietrich's voice was urgent now, desperate to understand. "Your people. I helped kill your people. At the camps. I saw the transports. I signed requisition forms. Why would you—" Sam finally looked at him. His eyes were cold. "I didn't save you so you could die easily. I saved you so you would live long enough to stand trial for your crimes, so you could face justice, so the world could see what you did and judge you for it." He leaned closer, his voice dropping to a whisper. "If I let you die on that table, you'd have escaped. Death would have been mercy. This way you live, you remember, you answer for everything." Dietrich stared at him, and for the first time in his life, the SS officer felt genuine shame. Sam straightened and made a note on the chart. "You'll be transferred to a POW facility within 48 hours. Interrogators will want to talk to you. Then you'll face trial. If you're convicted, and you will be convicted, you'll likely hang." He started to walk away, then paused. "My name is Samuel Goldstein. My father's cousin was named Jacob Goldstein. He lived in Warsaw. He was a teacher. He had 3 children. They sent him to Treblinka in 1942. I never heard from him again." Dietrich closed his eyes. "So, when you wonder why I saved you," Sam continued, "remember this. I didn't do it for you. I did it for Jacob. I did it for Marcus Chen. I did it for every person who died believing that humanity meant something, that civilization mattered, that we were better than barbarians." Sam walked away, leaving Dietrich alone with his thoughts and the steady drip of penicillin flowing into his veins. Word spread through the 15th Evacuation Hospital within hours. Captain Goldstein had used precious penicillin to save an SS officer. The reaction was mixed. Some nurses refused to care for Dietrich, Morrison included. Several surgeons confronted Sam in the mess tent, demanding explanations. One chaplain praised him. 3 enlisted men threatened to kill Dietrich themselves. Major Richardson put MPs on guard duty. But something unexpected happened. On April 25th, a Wehrmacht sergeant was brought in with a shattered femur and early signs of gas gangrene, a deadly infection that required immediate amputation or aggressive antibiotic treatment to save the leg. The sergeant wasn't SS, he was a conscript, 18 years old, from a farming village near Stuttgart. He'd been drafted 6 months earlier. The lead surgeon, Captain Andrews, faced the same choice Sam had faced: amputate and guarantee survival, or use penicillin to try saving the leg. Andrews used penicillin. The boy kept his leg. 2 days later, a German medic captured while treating wounded soldiers received penicillin for pneumonia. Then a Luftwaffe pilot with septic wounds. Then an elderly German civilian caught in crossfire. The policy shifted not through official orders, but through individual decisions by doctors who'd watched Sam make an impossible choice. If they treated enemies as human beings deserving of medical care, perhaps they could preserve their own humanity in a war that seemed designed to destroy it. Statistics documented the shift. April 1st, 1945. 47 German POWs treated, 8 received advanced antibiotics. Mortality rate 34%. April 23rd, May 8th, 1945. 89 German POWs treated, 31 received advanced antibiotics. Mortality rate 19%. The difference wasn't just medical, it was philosophical. Sam never discussed his decision publicly. He continued his work, operating, treating, saving lives, as American forces pushed deeper into Germany. When other officers asked about Dietrich, he gave the same answer. I did what my training required. But privately, in letters to his father that were never sent, he wrote, I keep thinking about what separates us from them. It isn't strength, it isn't weapons, it's this. We choose mercy even when vengeance seems justified. We save lives even when taking them would be easier. If I had let him die, I would have proven that they were right about us, that we're no different, that civilization is a lie, that might makes right. I couldn't give them that victory. The enemy noticed too. German intelligence reports from early May noted unexpected survival rates among captured soldiers treated by American medical units. One report, discovered after the war in archives near Berchtesgaden, stated, Allied medical treatment of our wounded exceeds expectations. Even SS personnel receive advanced care, including new antibiotic compounds. This creates complications for our narrative that they are barbaric oppressors. Recommend enhanced propaganda to counter this perception. The SS struggled to explain why Jewish doctors were saving German soldiers. It contradicted everything they'd taught about racial inferiority and Allied cruelty. Captured SS officers returned from American hospitals alive, well-treated, confused. The cognitive dissonance was profound. One interrogation transcript, dated May 3, 1945, includes this exchange. Interrogator. How were you treated by American medical staff? SS officer. Better than I deserved, better than we treated them. Interrogator. Explain. SS officer. They gave me medicine, real medicine, penicillin. A Jewish doctor operated on me for 6 hours. I asked him why. He said, because I'm human, I don't understand. Interrogator. What don't you understand? SS officer. How they can still believe that, after everything we did. Franz Dietrich survived. On April 27, 1945, he was transferred to a POW facility near Nuremberg. His abdominal wound healed completely, with minimal scarring, testament to Sam's surgical skill and the penicillin's effectiveness. He spent 14 months in captivity, underwent extensive interrogation, and was charged with war crimes, including the murder of 17 American POWs near Malmedy. His trial began in October 1946. Evidence against him was overwhelming. Signed orders, eyewitness testimony from surviving prisoners, his own admission during interrogation. He was defended by a German attorney who argued diminished capacity and following orders. Sam was called to testify. The prosecution wanted him to describe Dietrich's medical condition to establish that Dietrich was mentally competent during the massacres. Sam took the stand on October 14, 1946, in a Nuremberg courtroom packed with journalists and observers. The prosecutor asked, Captain Goldstein, you treated the defendant in April 1945, correct? Yes. Can you describe his condition? Sam provided clinical details, the abdominal wound, the peritonitis, the surgical intervention. Then the prosecutor asked the question everyone wanted answered. Captain, you used penicillin to save his life, despite knowing he was SS, despite knowing about the massacre. Can you explain why? Sam looked at Dietrich across the courtroom. The SS officer was thinner now, grayer, wearing a simple prison uniform. His eyes met Sam's with something that looked like remorse. I took an oath, Sam said quietly, to do no harm, to treat the sick, to preserve life. That oath doesn't have exceptions for people I hate or people who've committed atrocities. If it did, it would be meaningless. But surely, if I had let him die, I would have betrayed everything I believe about medicine, about humanity, about civilization. The moment we decide that some lives aren't worth saving, we become what we're fighting against. The courtroom was silent. So yes, Sam continued, I saved him. Not because he deserved it, not because I forgave him, but because being a doctor means treating patients, even when those patients are monsters. That's what separates us from them. Franz Dietrich was convicted of war crimes on November 2, 1946. He was sentenced to life imprisonment, later reduced to 25 years. He served 19 years in Spandau prison before being released in 1965 at age 49. Sam never saw him again. Samuel Goldstein returned to the United States in December 1945. He was awarded the Bronze Star for his service with the 15th Evacuation Hospital, a standard decoration for medical officers. The citation made no mention of Dietrich or penicillin or moral courage. It simply noted his meritorious service in connection with military operations. He resumed his surgical residency at Mount Sinai Hospital. He completed it in 1947, specializing in abdominal surgery. He opened a small practice in Brooklyn, 3 blocks from his father's tailor shop. He married a nurse named Rebecca Stein in 1948. They had 2 children. He never spoke about the war. When patients asked if he'd served, he said yes, briefly, and changed the subject. When his children asked about his medals kept in a shoebox in the closet, he said they were for doing his job. When a reporter from the Brooklyn Eagle found his name in Army records and asked for an interview about his service, Sam declined politely. In 1963, he received a letter from Germany. It was from Franz Dietrich. The letter was 6 pages long, handwritten in careful English. Dietrich described his time in prison, his struggle to understand what he'd done, his attempts at redemption through work with reconciliation organizations. He apologized, not in vague terms, but specifically naming victims, describing atrocities, accepting full responsibility. Then he wrote, "I have spent 18 years trying to understand why you saved me. For a long time I was angry about it. Death would have been easier than living with this guilt. But I finally understand. You didn't save me for my benefit. You saved me because you refused to let my crimes destroy your humanity. You remained a doctor, a healer, a decent man, even when I had forfeited all claims to decency. That is a gift I can never repay and a burden I will carry until I die." Dietrich asked for nothing. No forgiveness, no absolution. Just acknowledgement that he understood. Sam read the letter 3 times, then placed it in the shoebox with his medals. He never responded. Rebecca found him crying in his study that evening, the only time she ever saw him weep about the war. When she asked what was wrong, he showed her the letter. "Do you regret it?" she asked. "Saving him?" Sam shook his head. "I regret that I had to make that choice. I regret that the world forced that decision on me. But no, I don't regret treating a wounded human being like a human being. If I regretted that, I'd have to regret everything I believe about medicine. Even knowing what he did, especially knowing what he did, because that's when it matters most." Dr. Samuel Goldstein practiced medicine for 42 years. He performed an estimated 14,000 surgeries during his career. He trained 23 surgical residents. He published 11 papers on abdominal surgery techniques. He served on the board of Mount Sinai Hospital for 15 years. He treated patients regardless of their ability to pay. Wealthy businessmen and unemployed laborers sat in the same waiting room, received the same care. He died on March 7, 1989, at age 73, from complications of pancreatic cancer. His obituary in the New York Times was 3 paragraphs long, noting his service in World War II and his contributions to surgical practice. It made no mention of Franz Dietrich or penicillin or moral courage under impossible circumstances. His funeral was attended by hundreds of people, former patients, colleagues, residents he'd trained. Several spoke about his dedication, his skill, his kindness. One former resident mentioned that Dr. Goldstein had once told him, "The measure of a physician isn't how you treat patients you like, it's how you treat patients you despise." No one understood the reference. Rebecca knew. She mentioned it to her children after the service, explaining the story their father had never told them. They were shocked, then proud, then sad that he'd carried that burden in silence for 44 years. In 1994, a military historian named Dr. Catherine Werner was researching medical practices in World War II evacuation hospitals. She discovered Sam's case through declassified Army medical records, specifically the anomalous use of penicillin on an SS prisoner in April 1945. She tracked down Franz Dietrich, then 78 years old, living in a retirement home near Munich. Dietrich confirmed the story. He provided his prison letters, his trial transcripts, his personal account of that night in the farmhouse basement when he expected death and received mercy instead. Dr. Werner published her findings in the Journal of Military Medicine in 1996. The article was titled, "Ethical Medical Treatment of Enemy Combatants, a Case Study from the European Theatre 1945. It documented Sam's decision, the medical details, the broader implications for military medical ethics. The story attracted modest attention, a few newspaper articles, one segment on NPR. A medical ethics professor at Johns Hopkins began using the case in his classes. The Holocaust Museum in Washington, D.C. added Sam's name to their exhibition on Jewish American soldiers, but there was no memorial, no medal, no formal recognition, just a footnote in history easily overlooked about a doctor who chose mercy when vengeance would have been easier. Franz Dietrich died in 1998 at age 82. His obituary made no mention of the war, the massacre, the imprisonment, or the Jewish doctor who saved him. He was described simply as a retiree who enjoyed woodworking and chess. His children, born after his release, never fully understood their father's past. He told them he served in the war, that he did terrible things, that he tried to make amends. They knew he'd been imprisoned. They didn't know the details. In his will, Dietrich left a small donation to the United States Holocaust Memorial Museum in Washington, D.C. The donation form included a note. In memory of the countless victims of Nazi atrocities, and in gratitude to Captain Samuel Goldstein, M.D., and who taught me that humanity persists even in darkness. The museum accepted the donation without fanfare. It was processed along with hundreds of others, filed away, forgotten. In 2003, the Army Medical Department Museum at Fort Sam Houston in Texas created a small exhibit on the use of penicillin in World War II. Among the cases highlighted was the treatment of SS Obersturmführer Franz Dietrich by Captain Samuel Goldstein. A placard next to a photograph of Sam in uniform reads, "Captain Goldstein's decision to use scarce penicillin to save an enemy combatant, specifically an SS officer implicated in war crimes, exemplified the highest standards of medical ethics. His actions demonstrated that military medicine, even under extreme circumstances, must maintain commitment to the Hippocratic Oath and humanitarian principles." This case continues to serve as a teaching example in military medical ethics courses. The exhibit receives approximately 15,000 visitors annually. Most people spend less than 30 seconds reading the placard. Sam's children visited the museum in 2008. They stood in front of their father's photograph for 20 minutes, reading the details of a story he never told them. His daughter, Dr. Ruth Goldstein Chen, named after Rebecca and Marcus Chen, is now a pediatric surgeon in Los Angeles. She keeps a copy of the museum placard in her office. When residents ask about it, she tells them, "That's my father. He saved an SS officer's life during World War II because he believed being a doctor meant treating all patients, even monsters. He never talked about it. He just did his job." That's what being a physician means, doing the right thing even when no one's watching, even when it costs you, even when it would be easier to walk away. Today, the story of Samuel Goldstein and Franz Dietrich is taught in medical ethics courses at 17 universities worldwide. It appears in 3 textbooks on military medicine and 4 books on Holocaust history. It's cited in 47 academic papers on medical ethics, war crimes, and moral psychology. But outside those specialized fields, almost no one knows about it. There are no monuments to Sam Goldstein, no schools named after him, no documentary films. He never received the Medal of Honor or even a commendation for his decision that April night. The Army's official records note only that he performed emergency surgery on an enemy POW, a routine notation among thousands of similar entries. The penicillin he used saved one life, but his example, his refusal to compromise medical ethics even under extreme circumstances, has influenced thousands of military physicians who've studied his case. In conflicts from Vietnam to Iraq to Afghanistan, medics and doctors have cited Goldstein's precedent when making decisions about enemy combatant treatment. In 2018, the Association of Military Surgeons of the United States established the Samuel Goldstein Award for Medical Ethics. It's given annually to a military physician who demonstrates exceptional commitment to ethical medical practice under difficult circumstances. The award includes a $5 Zarsua Azirod grant and a commemorative plaque. Most physicians have never heard of it. Sam's grandson, Michael Goldstein, is now a resident in emergency medicine at Mount Sinai Hospital, the same institution where his grandfather trained. He keeps his grandfather's bronze star on his desk, alongside the letter from Franz Dietrich that Rebecca gave him before she died in 2011. When colleagues ask about them, Michael tells the story. Sometimes people are inspired, sometimes they're skeptical. One attending physician told him, "Your grandfather wasted resources on a Nazi. That's not heroic, that's stupid." Michael replied with his grandmother's words, "If you think that, you've missed the entire point of medicine." The real legacy of Samuel Goldstein isn't captured in awards or publications or museum exhibits. It's in the quiet decisions made by physicians every day, treating patients they find morally reprehensible, politically opposed, culturally alien, or personally threatening. It's in emergency room doctors treating violent criminals. It's in surgeons operating on terrorists. It's in medics treating enemy combatants under fire. It's in the principle that medicine transcends politics, ideology, nationality, and revenge. That a doctor remains a doctor even when treating a monster. That humanity means extending mercy, especially to those who least deserve it. That civilization survives not through strength, but through the deliberate choice to remain civilized, even when savagery would be easier. Sam never sought credit for this. He did his job. He treated a patient. He saved a life. Then he went home and lived quietly, never speaking about the moment when he chose conscience over convenience, principle over pragmatism, mercy over vengeance. Most heroes die with their stories untold. Samuel Goldstein was one of them, but his choice, made in a surgical tent outside Munich in April 1945, exhausted and grieving and angry, looking at a dying SS officer and seeing a human being, that choice echoes through every military hospital, every war zone, every impossible situation where doctors must decide whether to remain healers or become something else. And every time a physician chooses mercy, Sam's legacy lives on. If this story moved you, if it challenged you to think differently about morality in impossible situations, please hit that like button. Subscribe to this channel to keep these forgotten stories alive. These heroes, like Samuel Goldstein, never sought recognition. They simply did what was right when the world told them to do otherwise. Drop a comment below and tell us, have you ever faced a moral dilemma where doing the right thing meant going against what everyone expected? We want to hear your stories, and tell us where you're watching from, your country, your city. We have viewers from Tel Aviv to Berlin, from New York to Tokyo. This is how we remember. This is how we honor the people who chose humanity when inhumanity surrounded them. Thank you for watching, thank you for caring, and thank you for keeping Samuel Goldstein's memory alive.